Welcome to your Intrapartum unit. This is the introduction to the lessons that we will be covering the concepts associated with the nursing care of the patient and family during labor and birth. The objectives of this lesson include review the factors included in the initial assessment of the woman in labor, describe the ongoing assessments of maternal progress during the stages of labor, recognize the physical and social findings indicative of maternal progress during labor, describe fetal assessment during labor, identify signs of developing complications in labor, recognize the importance of family support, cultural and religious beliefs during labor and birth, and describe the role of the nurse during labor and birth. The labor process is an exciting time for the pregnant woman and her family. They are about to experience one of the most profound changes of their lives. Labor begins with the first uterine contraction, continues with hard work during cervical dilation and birth, and ends as a woman and family begin the attachment process. Nursing care focuses on assessment, support, the best possible outcome. Assessment begins at the first contact with the woman, whether it is by telephone or in person. Once the woman arrives at the hospital, a more comprehensive assessment will be conducted. Admission data gathered includes prenatal data, interview, psychosocial factors, stress in labor, and cultural factors. There are 4 stages of labor. The first stage of labor begins with the onset of regular uterine contractions and ends with the complete dilation of the cervix. The 3 phases of the first stage of labor include the latent phase, which goes until the woman reaches 3 centimeters dilation, the active phase, which is from 4 to 7 centimeters dilation, and the transition phase, which is from 8 to 10 centimeters dilation. Care management during this time. Nulliparous women seek admission during the latent phase. Multiparous women do not usually come to the hospital or birth center until the active phase. And there is the factor of determining true or false labor. The second stage of labor begins with complete dilation of the cervix and continues until the baby is born. The third stage of labor begins immediately after the birth of the infant and ends with the delivery of the placenta. The fourth stage of labor begins after the delivery of the placenta and is a time of bonding between mother and the baby and the family with the baby. It is during this time that the mother's body begins the adjustment to pre-pregnant state and the infant begins to adjust to life outside the uterine environment. This concludes the introduction to our intrapartum unit.